because hospice has a horrible connotation associated with it, but it means death. But if you take the word hospice out of it, it actually means quality of life. So when we come in, we try to take away the association of death with it. Because especially for our CHF patients, you do have to qualify for hospice. It has to be a terminal illness. CHF is a terminal illness. But we know a lot of people walking around with CHF that have it for a long time. Halcyon Hospice, we piloted a program a year ago. We had 12 patients that we started on our pilot program for CHF. And we had 3 of our patients graduate, not graduate to heaven, but graduate off of hospice back into normal daily life. We do symptom management, we did medication management, we did education, and taught them how to manage their CHF. So their ejection fraction, which qualified them for hospice, won't ever change. But they learned how to manage the disease so well, they no longer needed our services, and they live a quality life now. If they ever need hospice care and the support that we provided to them and to their family, they'll call us again. But they actually are living better quality of life. The one lady said she's living a better quality of life now than she lived in the last 7 years. So while hospice is associated with end of life, it doesn't necessarily mean you have to have one foot in the grave. And we try to educate not just families and the patients, but also the doctors that are writing the orders and the discharge planners at the hospital, because a lot of times they're the ones that need the most education, because they're the ones waiting until the patient has, one foot in the grave before they actually give us a call. So what is hospice exactly? Hospice you do have to have a life-limiting illness. You do have to qualify medically under Medicare's guidelines. They're the ones that set the standards for it. So you do have to have an illness that typically you have a lifespan of 6 months or less. But and it can be any kind of illness: cancer, CHF, stroke, dementia. Dementia is a hard one to qualify with. They really want you to be able to speak 7 words or less, making sense, 7 words or less. Pretty much be non-ambulatory with dementia, that sort of stuff. End-stage kidney disease, end-stage liver disease, that sort of stuff. Anything that your lifespan is really going to be about 6 months or less. But like I said, with CHF, we did a pilot program. Education is a big thing. So we educated our families, we educated our patients, and 3 of them graduated back into a better quality of life.